welcome to TryRide. This is Pack 365. Myself Srija. So today in this session you are going to learn about the continuation of ICD-10 coding guidelines for pregnancy, childbirth and puerperium. So what is the N guideline? Normal delivery code O80. So O80 is used when a woman has a full-term normal or uncomplicated vaginal delivery of one healthy baby. So this is the simplest delivery code and it is used only when everything is completely normal. So when to use O80 code for full-term uncomplicated delivery? So you have to assign O80 when the mother is admitted for a normal delivery, pregnancy is full term and she delivers one live healthy baby. So there are no complications. No complications before birth, no complications during labor and no complications after delivery. So OIT, it is always the pregnant principal diagnosis. So this means it must be always assigned first in the diagnosis list. So why important? Why it is important? You should not use OIT if there is any current pregnancy complication. For example, hypertension, diabetes, bleeding, fetal distress and labor dystocia. So the patient delivers twins, triplets or more. So delivery is preterm or postterm with the complications. So there is an instrumental delivery complication, for example, forceps injury, vacuum complications, etc. So what are the additional codes allowed? Other codes can be added only if they do not complicate the pregnancy. For example, maternal obesity, anemia not affecting the pregnancy, GERD, migraine, etc. So what is the guideline for uncomplicated delivery with resolved antepartum complication? Sometimes the mother had a complication earlier in the pregnancy, but it is not present when she is admitted for the delivery. It does not affect the labor or delivery now. So in that case, you can still use O80. For example, she had anemia in the second trimester, but it was treated and normal at the admission. She had placenta previa earlier, but it is resolved. So if the complication is resolved, O80 is allowed. So what is the guideline for outcome of delivery for O80? So to complete the coding, you must add an outcome code. For O80, the only valid outcome is Z37.0 for single live birth because O80 is used only for a single healthy baby. So this outcome code is always paired with it. So always remember you have to use O80 code only when it is a full-term delivery, normal spontaneous delivery, no complications now, one healthy baby and vaginal birth. So you should not use O80 when it is a preterm or postterm baby with issues, whether they are a twins or multiples and any current pregnancy or delivery complication. So you have to must add the outcome Z37.0 for single live birth. Okay. So this is about the end guideline. So next is guideline about peripartum and postpartum periods. So this section explains the time periods around childbirth and how to code complications that happen during these periods. So the first guideline is about peripartum and postpartum period. So postpartum period is nothing but after delivery. So it starts immediately after the baby is born and it continues for 6 weeks, that is 42 days. So this is a time when the mother's peripartum period it's around the time of the delivery. So it is defined as the last month of pregnancy and up to 5 months after the childbirth. So why 5 months? Because some conditions related to pregnancy can show up even after the 6-week postpartum period. So this is about the peripartum and postpartum period. Now, what are the complications of these periods? So a postpartum complication is any medical condition that develops during the first 6 weeks after the delivery. For example, a postpartum hemorrhage, postpartum infection, mastitis, postpartum depression or perineal wound infection. So if the complication occurs within the 6-week window, you have to use chapter 15 O codes. So next is pregnancy related complications after the 6-week period. So even after 6 weeks, a condition can still be due to the pregnancy. So what is the rule over here? If the doctor documents that a condition is pregnancy related, you can still use chapter 15 codes even beyond the 6 weeks. For example, like thyroid dysfunction appearing 3 months after the delivery but noted as a pregnancy related. So cardiomyopathy, it is noted as the postpartum cardiomyopathy even at 4 to 5 months postpartum. So persistent hypertension diagnosed after the usual 6-week period. So you have to use O codes if it is stated as a pregnancy related even outside the usual time frame. So now what is the guideline for admission for the routine postpartum care after the delivery outside the hospital? So when a mother delivers outside the hospital, like home delivery, ambulance delivery, etc., and it comes to the hospital for routine postpartum checkup with no complications. So you have to assign Z39.0 code for encounter for care and examination of mother immediately after the delivery. So this is the principal diagnosis. So why it is important? You have to use Z39.0 code only if there are no complications, right? So if the complications are present, you have to use the appropriate O code instead. So this is the sequence, or this is the rule for coding for the admission for the routine postpartum care. So next is pregnancy associated cardiomyopathy. So what is pregnancy associated cardiomyopathy? It's a type of heart failure that develops late in the pregnancy or after the childbirth. So it usually appears in the third trimester or within 5 months after the delivery. So it can continue to worsen even months after the childbirth, which makes it different from the normal pregnancy related symptoms. So ICD-10 code O90.3, it is used only when the cardiomyopathy is caused by pregnancy and the mother had no previous heart disease before the pregnancy. So why is it called peripartum cardiomyopathy? Because it starts around the time of delivery. It can continue postpartum after the delivery. So symptoms include shortness of breath, swelling, fatigue, and chest discomfort. So it is rare but serious. So it can lead to long-term heart problems if untreated. So what is the next guideline? Code O94, which describes sequelae of the complication of pregnancy, childbirth, and the puerperium. So what is the first? What is a sequela first? A sequela is a long-term or late effect of a condition. We have discussed about sequela in the ICD-10 conventions, right? So what is the example of a sequela? A mother had a preeclampsia during the pregnancy. So now has the chronic high blood pressure months or years later. So this long-term result is called as sequela. So O94 is used when a past pregnancy complication causes a health problem later. So code O95, what it is used for? Code O94. So code O94, it is assigned when a woman had a pregnancy complication in the past. I know she has a long-term effect from that complication. So she is receiving the treatment for this late effect. So what will be the examples? Cardiomyopathy continues months or years after the delivery. The second example is the chronic pelvic pain due to past delivery trauma and persistent hypertension due to past preeclampsia, scar or fistula after the obstetric injury. So O94 tells us the condition, it is a result of previous pregnancy complication. So next is O94 can be used anytime after pregnancy. So there is no time limit for using O94. This can be used after 6 weeks of postpartum, can be used after the months, can be used after the years. So as long as the doctor confirms the condition is a sequel of a previous pregnancy or delivery complication. So you can use this O94 code. So what will be the sequencing or what is the order of coding for O94? So when using O94, it is never the first or main problem. You must first list the condition the patient is being treated for example, like cardiomyopathy, hypertension, and pain. So then you have to assign O94 category code to show it is due to a past pregnancy complication. Like mother being treated for a chronic cardiomyopathy. So you have to code the order cardiomyopathy code, then O94 to show it is resulted from the pregnancy. So this is a sequencing of the code O94. So next guideline is about termination of the pregnancy and spontaneous abortion. So this shows you how to code two special situations related to the abortions in ICD-10-CM. So what is the first one? Abortion with a live born fetus. So sometimes a woman goes for an elective termination of pregnancy, but the fetus is born alive instead of the pregnancy ending or as planned. So in this case, we must use special codes. So what are the codes to assign? Z33.2 code. This means encounter for the elective termination of pregnancy. So this is used because the woman came for a planned abortion. So then Z37 is for outcome of delivery. A code from this category shows the result of the delivery. Since a live baby was born, a live birth outcome code from Z37 must be added. So how do you understand in a simple way? Even though the pregnancy was supposed to end in abortion, if a live baby is delivered, it is coded like a delivery, but not like an abortion. Okay. So the second one is retained products of conception following an abortion. So after an abortion, either spontaneous miscarriage or elective, sometimes tissue from the pregnancy remains inside the uterus only. So this is called as the retained products of conception, RPOC. So what are the coding guidelines or coding rules for these retained products? So if the patient comes later, not immediately, later, for the treatment of retained tissue and there are no complications, so you have to use code O03.4, which describes incomplete spontaneous abortion without complication. So this is used when the miscarriage happened naturally. Or code O07.4, failed attempted termination of the pregnancy without complication. So this code is used when an elective abortion was attempted but the tissue is remained. So this rule applies even if the patient was previously told the abortion was complete, but later it returns because this tissue is still present. Okay, so this is how you code this retained products of conception following an abortion. So next is, if a patient has a specific complication, sometimes after a spontaneous abortion or an elective abortion, the patient may develop a specific complication such as infection, heavy bleeding, sepsis, and injury to the organs. So if such a real complication is present, you should not use the basic retained products codes, that is O03.4 or O07.4. So instead, you have to assign the exact complication code. So examples like O03 for complications of spontaneous abortion, O04 for complications of elective abortion, and O07 for failed attempts with the complications. So if a complication is documented, you have to code that specific complication but not the general incomplete abortion code. So what is the guideline for complications leading to abortion? So sometimes pregnancy itself has complications that causes the abortion. For example, like severe infection, uncontrolled bleeding, birth defects, and also maternal illness like heart disease, hypertension, etc. Now, what is the coding rule for these complications? You can add codes from chapter 15 to show the underlying complication along with the abortion codes from the categories O04, this is for elective termination, O07, this is for failed abortion, and O08, this is for complications after the abortion. So what is the meaning? If the pregnancy had a problem that caused the abortion, you can code both the pregnancy complication from chapter 15 as well as the abortion outcome. So next guideline is about hemorrhage following elective abortion. So if a woman has heavy bleeding after an induced abortion, for example, after taking pills or after a surgical termination, so what is the correct code to assign? O04.6. So this describes the delayed or excessive hemorrhage following induced abortion. So this exactly describes bleeding after an elective termination. So you should not assign code 072.1 because 072.1 it is only for the bleeding after the childbirth but not the abortion. So after an elective abortion, bleeding is coded under 004.6 but not the postpartum codes. And our guideline is about abuse in a pregnant patient. So if a pregnant woman is suspected or confirmed to be a victim of physical abuse, domestic violence and assault. So what is the correct coding? You have to use codes from 098.3 category, which describes physical abuse complicating pregnancy, childbirth and puerperium. So this shows that the abuse is affecting the pregnancy. So if a pregnant woman is abused, you have to add 098.3 code to show that the abuse happened during the pregnancy. So part 1 is when COVID-19 is the main reason for the hospital admission. So if a pregnant woman comes to the hospital because she has COVID-19, so then what is the first listed or principal diagnosis? 098.5. So other viral diseases complicating the pregnancy, childbirth and puerperium. So this is always the first code because chapter 15 codes come first. And what is the additional code? U07.1 for COVID-19. So any other associated conditions, for example, pneumonia, respiratory failure. So why this sequence? Because in pregnancy, O codes always take the priority even if the COVID is the main problem. And what is part 2? When COVID-19 is not the main reason for admission. Sometimes the patient is admitted for another reason, for example, like labor pain, hypertension, but she also tests positive for COVID-19 during the stay. So in this case, how would you code? The first one is the first listed or principal diagnosis. So you have to code the reason for admission. For example, O80 for normal delivery or O13 for pregnancy hypertension. And the additional code is O98.5 for pregnancy complicated by viral disease and U07.1 for COVID-19. So any COVID related symptoms if present, you can add another additional code. Why? Because COVID-19 was not the reason she came to the hospital. Okay. So why is puerperium? So why do O codes take priority? Because ICD-10 rules say that when a condition complicates pregnancy, childbirth or puerperium, the pregnancy chapter comes first. So why is O98.5? Because a category it is used whenever a viral infection affects pregnancy. But the virus is specified by another code like COVID. So what is U07.1? This is a lab confirmed COVID-19 code. Here are a simple example so that you can understand better about how to code this COVID-19 cases in the pregnancy. So the example 1 is pregnant woman admitted because of fever and test positive for COVID-19. So what is the COVID sequence? O98.5 first, then COVID-19 code U07.1 followed by pneumonia. This is a COVID related symptom, right? Pneumonia if present. So second example is pregnant woman admitted for delivery but COVID positive during admission. So coding sequence is O80 for normal delivery and then you have to add the code O98.5 followed by COVID code U07.1. So this is about the chapter 15 codes related to pregnancy, childbirth and puerperium. So now let's talk about ICD-10 coding guidelines for certain conditions originating in the perinatal period. So what is the perinatal period? It begins before the birth and continues until 28 days after the baby is born. So any condition affecting the newborn during the first 28 days is coded under the chapter 16. So chapter 16 codes are P002 to P96. So what is the use of chapter 6 codes? Simple explanation is like chapter 16 codes are only for this baby's medical record. So these codes must never be used on the mother's chart. Similarly, codes from chapter 15 are used only on the mother's chart but not the baby's. Why? because the baby and the mother are treated as two separate patients, each with their own diagnosis. So what is the important note here? Chapter 16 codes, they may be used any time in the baby's life if the problem started in the perinatal period and it is still affecting the child. For example, like a baby had a birth injury like brachial plexus palsy and still has weakness at the age 1 year, you can still use the P code. So what is the principal diagnosis for the birth record? When creating the newborn's birth record, the first code, the principal diagnosis should always come from category Z38, the live born infants. So Z38 describes the place of birth and the type of delivery. Okay. So what is the very important rule over here? Z38 is assigned only once in a baby's life at the moment of the birth. So if the newborn is transferred to the another hospital on the same day or later, you should not assign Z38 again at the receiving hospital. Only once is enough. So this is about the general introduction to chapter 16 codes. So this is for today's session. I hope this session has helped you. So in the next session, you will be going to learn about the guidelines related to chapter 16, conditions originating in the perinatal period. Thank you.